Yes.
Okay. So again, we are Interact for Health, and our mission is to promote health equity to improve the health of all people within our region. So we do that currently through grants, education, so education for both community members as well as organizations, research such as surveys and other data-driven projects, working on policies such as Tobacco 21 here in Cincinnati, and some other policies within the region, and then general engagement with the community. So currently, we have an area that focuses on 20 counties. So that includes counties within Indiana, Kentucky, and Ohio. So we have urban, rural, and suburban areas. And we have broken ourselves into 4 different strategies. So we have reducing tobacco use, addressing the opioid epidemic, school-based health centers, and then COVID-19 response. So currently we're going through a strategic planning process, and we're looking to build a 5-year strategy for Interact for Health that defines our unique role in the community and outlines our top priorities to drive the most impact towards our mission. We have literally been running at about 100 miles an hour doing this right now. So we are have a very condensed timeline between February and December that we're looking to create this plan. But we do have some guiding principles that we're working off of to make sure that we're doing this correctly. We will send their equity in the process. We will listen. So we want to have voices from a broad group of stakeholders across our region. We will learn, and really we're trying to run towards criticism. So we're not just trying to hear the things that praise us. We want to hear it all in ways that we can change or what areas are missing that need some gaps filled. And we will lead where we can. So we are willing to be own and drive the process internally. So we're working on things internally, but we also are making sure that we're transparent and provide regular updates. So we're making sure that even just the community itself knows exactly what's going on in our process. This is one of a few different ways that we are engaging people. So we've been doing stakeholder interviews. We have done surveys with different organizations. But right now we're really working to try to make sure that we're listening to community members, maybe who do not all work in healthcare. So far, we've talked to around 90 different people throughout our region. So we've been to Brown County, we're going to Highland, and all different places in our region. Just literally, sometimes it takes us longer to drive than ask the questions. But we feel that it's important to make sure that we are hearing people's just kind of gaps and hearing what community needs there are, and how we can better serve those. So with that, we have three like main questions that we want to ask, and they're that can help open the discussion, and we'll go from there.
And I'll just add something real quick, Julian, too.
Yes.
An interesting fact about Interact for Health. So we were founded in 1997 when a managed care plan closed. And so each year we pull from our endowment to give out the money that we provide in grants. And so I think that makes us a little bit unique. I think sometimes when people think about foundations and philanthropy, they think about raising funds. And for us, that's not the case.
Yes. So we do not do like where a lot of places would do like the charity drives or campaigning for money and stuff like that. We don't have that need. We have our own reserves that we are working off of. So we do have a very unique position that we can hold in the community. We can say things that other people won't say, not having to worry about if our money is going to get funny by asking questions. So we really want to make sure that we are listening to the community in a different way in this process. And the person you just heard speaking is Ashley Young, who's one of our executive team members who just joined back with us. We're super excited to have her, will be joining in this call. So it's not just me speaking, you're also talking to leadership. So you're kind of right at the top in this process as we're going through the strategic plan. So the first question we have, is there more we can do? So philanthropy usually is defined as focusing on integrity, generosity, change, giving of your time, talent, and treasure, lending a hand to your neighbor leadership, building bridges between class, race, and gender, unity, improving the world. But we understand that that can be a lofty thing that not everybody fully understands what it is. So as an organization that in many ways is known to give money for programs and projects, but also to help inform policy, help be at tables with leadership and different things like that. What more can an organization like us, a philanthropic organization, can we do? What areas do you see that there are gaps in that no other organization may be filling right now? In terms of around health, around equity, around housing, social determinants? Is there anything that you see that we can fill? And I'm a person, I like when people talk to me, so feel free just to converse and talk with me through this process. Let me open it up so I can see more faces.
All right.
Yeah, you can stop sharing. Maybe stop sharing.
Yeah, I can do that.
So Julian, this is Ken Best.
Yes.
And you talked about a few things. You talked about equity in housing. I don't think that you necessarily have to take it upon yourself to, or, your group, your organization, to improve that, because there's other organizations that are dealing with that, like the Port. For example, they have purchased, I want to say 100+ homes of people in low income areas and offered to, build them up and make it affordable for the residents who currently live there to own those homes and stay there. So maybe it's a matter of partnering with the Port to help them with that initiative, instead of trying to just do it on your own when it's already being done in an effective way. So that's how you might be able to help in that respect, by partnering with the Port and seeing how you can plug into what they're doing already, instead of trying to reinvent the wheel. Because I think we have a lot of organizations, nonprofits that are doing the same thing as other organizations, and it's a lot of duplication. And why, when there's a group already doing that, they're dedicated to it, just kind of plug in and see where you can help out. That's an example. Yeah.
Thank you for that. And absolutely, I think we definitely see this is that we're not trying to do anything by ourselves. We understand that that cannot be our role. We definitely want to partner and be part of the solution, be at the conversation and table, but maybe understanding some of those organizations that we should kind of reach out to and partner with.
Yeah.
And Tracy Howard, you have your hand raised?
Yes, I do. Thank you. I work with children at my church. And when I saw the topic and I saw some sentences that were focused on youth and the health of youth, I was really hoping that you guys would be at least somewhat focused on the mental health of our young people. Going through this pandemic was very stressful on our young people and remains so. And there are so many repercussions of this mentally upon them, the stress, the anxiety, the potential social distance. I really did not like that term when I heard it introduced in the media, social distancing, because I thought it created this sense of social distance, and we need to love one another and care for one another. And I'm concerned about how that is impacting our young people long term.
Absolutely. Thank you for that. And definitely we've been hearing a lot of the need to increase services and aid and education around mental health for youth and adults. So definitely thank you so much for that.
Yeah, that's a good one.
It is good.
Go ahead.
I was going to kind of go around to help out, Julian. Did Stephen, did you have any comments or anything you wanted to add, or introduce yourself to the group?
Hey, I'm Stephen Miller. Me and Julian are frat brothers, both men of Phi Beta Sigma Fraternity Incorporated.
Amen.
And I was just calling. I called in the last meeting you had. I think it was back in April, something like that.
Mhm.
So I'm new, kind of new here. Just want to say hi to everybody. I work at Humana Health Insurance as a correspondence specialist. So just trying to grow my network.
Yeah, yeah. So in your work, I mean, you're in healthcare. So I guess Julian's trying to get some help and just some insights on what you see for people who, you come across and some of the challenges that they have with healthcare. I mean, it can even be financially, like paying for things, but we just want to kind of get the conversation started. So what are some of
Oh,
your
yeah.
viewpoints?
Most people with, especially when the pandemic happened, health insurance and health costs went up. So a lot of people are having problems with getting their health insurance paid or getting their coverage paid if they had coverage during the pandemic or had services during the pandemic. So that's like a main focus on everybody right now. How to help everybody get over that.
Yeah, I find it to be, so this is me talking now, Julian, so confusing, right? Just the whole healthcare, like what to get, what coverage, what covers this, then I take my child in and now my deductible or talk, I mean, like, I don't know if you guys help in education of like what to select, but a lot of us struggle with, do we have adequate coverage or are we overpaying and not using, those types of things.
Right. And most people get it through their employer. So their employer should have a rep come in from each insurance company, show them the ins and outs. But if you don't know really the terms like deductible and copay and co-insurance, stuff like that, it can be confusing, really confusing, as far as how much coverage to get and how much premium you should pay and stuff like that. So education is real important.
With that, do you feel that, because as we talk about education, do you feel that could there be an increase in access? So do you think that everything is accessible? So even in terms of location, should there be some work around making things more centrally located for people to get to, or like working with organizations to have extended hours, anything like that? Do you feel that that's needed?
Yeah, extended hours will help because people working throughout the day, particularly 8 a.m. to 5 p.m. So evening hours, and put the education in the evening hours will help too. And just list or tell people the available options they have as far as health insurance. I had a friend call me a couple of weeks ago because they don't have an insurance through an employer, and they were asking, how can I get health insurance? I'm like, I had to send them to the Affordable Care website, and they didn't know how to navigate the website. They didn't know what to choose. So stuff like that happens a lot in our community.
Thank you for
Thanks,
that.
Stephen. Appreciate it. Alicia Thompson, you want to introduce yourself to the group? Do you have any maybe comments on the topic or any insights? You're on mute.
I'm just happy to be here. I don't have anything I want to add right at the time, but I reserve the right to jump in later. If that's okay.
Yeah, that's great. That's great.
Alicia wrote a book.
Oh, you got to tell us about the book real quick. Yeah, we want an introduction, like we're, a little bit about
Oh
this.
my gosh. All right. So yes.
We're all family here.
I'm an author. The title of my book is When Your Soul Whispers, and it's leadership strategies for people who want to redefine values and move forward after a life transition. And I'm also a global leadership reinvention strategist, which means I equip workers' comp and other leaders with strategies to move forward after, of course, life transitions, but to be more specific so that they can thrive professionally and personally.
Okay.
And I'm from Cincinnati, career and work comp with Macy's and Bloomingdale's.
Wow, thank you for that.
Thanks.
Just to bring everybody back up to speed, Julian, the overall question, maybe we'll have somebody that has some insights for you.
Again, my name is Julian Collins, Community Outreach Officer with Interact for Health. We are a regional private health foundation that works currently in tobacco, opioid, and school-based health center work, as well as COVID-19 response. We're working on a strategic plan, and in that, we're trying to decide who we are and what we need to kind of be. So as a philanthropic organization, what more can we do for the community? So that's our question here. And I know Mr. Gino or Dr. Gillette has heard me talk about this many a times. We've been working together a lot. So hello.
Julian, how are
Hey,
you?
I'm all right.
I'm
How are
sorry.
you?
Go ahead. Am I speaking?
I'm sorry. I had a question for Julian.
Yes.
Hi, my name is Mia Williams, everyone. I was on a few calls quite a long time ago, and then I had a baby. So now I work from home with a 7-month-old infant.
Congratulations.
Thank you. But I just kind of wanted to know, because I'm, a little new to hearing about your guys' organization. I just want to know if you guys kind of do some partnering with churches and things of that sort. I attended church. It's a predominantly Black church. I'm here in Cincinnati, Ohio. It's called St. Andrew's Episcopal Church. But it's over on Rutland Avenue, in the in Evendale area. So I just wanted to know what you guys do in regards to that.
Sure. So we have partnered with churches before. So currently our funding focuses are usually COVID-19 response. So we did some grants around that where we did have a lot of church response. We also do reducing tobacco use. So that could be smoking cessation programming. That could be working on policies, helping places go smoke free. We did a lot of work with New Prospect on that. So we have worked with churches in many different aspects. Also, we do working to reduce opioid use. So we have worked with the African American Engagement Work Group, which has done a lot of work with churches to create some response teams and help people who are in active addiction or who are currently users have a safe space that they can come to ask for resources and help. So we have worked with churches in many different ways. It all depends on the programs that they come to us with, but we do have that experience as well. As long as it's a nonprofit, we're willing to have those conversations and build those relationships to work.
So churches can apply for grants at a very fundamental level. Okay, that's great to know.
Yes, they can.
That's a lot of times there's confusion around that.
Awesome. Yeah, I just wanted to get kind of some insight on that. I know I've been in healthcare for quite some time now, probably about 4 years now altogether. I went from a company called Chin Medical, and then I became the director assistant now at a company called True Staff. So I oversee travel nurses worldwide. So I guess my biggest thing was just kind of see how you guys, kind of tie into everything that's going on right now as far as the shift with, pre-COVID into now. So
absolutely. Definitely is. We have been trying to be as flexible as possible and shifting as possible, but we have been working with organizations, doing coalitions, being at the table just to kind of figure out how we can fit ourselves in. Luckily, in working with organizations, we are willing sometimes if an organization has things that they need to say or there's those hard conversations, we have set ourselves up as a safe space to have them. We used to have just in our space or we setting up the meeting ourselves, we can be that neutral body to do that sometimes because we do not have any funding coming into us that we are worried about jeopardizing. So that is one also way that we act. That is a way that we engage the community on a stronger level, working with places such as the Health Collaborative on things such as the health needs assessment and different things like that, having those conversations to bring everybody to the table.
That's great.
Okay.
I have a quick question. Due to the intersectionality of our entire diaspora of Black people, I just want to ask, do you all address health issues within the LGBTQIA+ community, and do you reach out to youth there so that they're knowledgeable about protections, STIs, STDs, things of that matter?
So currently, the way that we operate, we do not do like direct outreach to the community. We work with organizations to do that. So we give like grant funding for programming that does that. So we have worked with places such as Caracol to do different things like that. We do definitely see the need for that, and we definitely believe in that internally and just kind of from an equitable standpoint of our organization. But currently, I don't think we have a grant that specifically goal targets that, but we're working with Caracol for a syringe exchange vending machine. So that provides just the kits, the safe kits that they need to make sure that it's part of harm reduction. So making sure that people do have as safe of an experience as possible, even if they're still in active addiction. That makes any sense?
Yeah, one more question. Is there dietary education available?
So we currently do not offer dietary education, but there are some organizations that we have in current conversations that do offer that dietary education, that nutrition education. One of those actually being on the call down below in my screen, Diesa Dorsey, who is Icon Health, who works around diabetes prevention. So we have had those conversations with different partners.
Sounds great. Thanks, Ebony. I did have a question, Julian.
Yes.
Just like, do you guys support organizations that handle or are trying to get more diversity in nursing and in healthcare with doctors? There seems to be very few African-American doctors in the city, right? So like, is there initiatives around that, or could there be?
There absolutely could be some initiatives around that. That definitely has been part of the conversation of a need to diversify our health workforce. We have definitely been having conversations with places such as the Doctors Foundation, and places, which is a local foundation that works to help to increase the number of doctors of color. So increasing the number that are going through the programs, but not only increasing the number that goes to the program, but actually stays here for residency. A lot of people will get trained here and then leave. So working to just make it a better environment for people who want to stay here. So that's increasing housing stock, that increasing just kind of social activities and stuff like that for people to get to know Cincinnati as a location to want to stay. So those conversations have been had.
At some point, there were a lot of Black doctors here. When my family and I first moved here in 2002, there were a plethora. Most of them did the mass exodus due to a lot of the changes in their insurance policies. And there were a lot of malpractice suits, and it caused their premiums to go up. And it just did not become an African-American doctor-friendly city. And a lot of them left. So, you know, that's part of that history, because I was wondering, well, what happened to them? Who was on the top doctors list now? Where did they go? Most of them relocated to Florida and other states, well-known, established in the community, because this was not a friendly town. And another soror who's a medical doctor transitioned to a corporate medical environment to help balance that. So I know there is a need, and she had had her practice for over a decade. So there is a huge need to support Black doctors, both in a business structure format, also in the financial arena, but it's a heavy financial burden when they have their own private practice. And most are called to do that. It's a calling for them, and they do an exceptional job, but sometimes it's just not as appreciated from the feedback that I've been given by the doctors who left.
Absolutely. And just in our conversations with healthcare leaders throughout the community, we've definitely been hearing some of the same sentiments. Anything else around, as an organization, what we can do before we go to our next question? Next question is my favorite, so.
Let's get to the favorite. Go ahead, Ken.
I'm not sure if there's a shortage of health clinics in underserved neighborhoods anymore. I'm not on the pulse of that because I don't live in Cincinnati anymore, but it seemed like that used to be an issue, having access to healthcare in your community.
Definitely. And definitely it all depends on the neighborhood, but it's also about trusted healthcare. Just because there is a clinic in a space does not mean that people want to go there. So that's part of the conversation that we've definitely been having.
So Julian, one of the things I want to know, what about like cancer awareness, breast cancer, just specifically for Black women? So speaking as a breast cancer survivor, and speaking to a sister today, the support and the treatment that we receive is totally different. Financial obligability, the financial help and assistance is ludicrous. I think the awareness around breast cancer in our community is just lacking. I don't think a lot of people talk about it. Being honest, I've been cancer-free 5 years. This is probably the first time I spoke about it in public in this platform, right?
Mm-hmm.
So I think that is a huge thing that's missing in our community. So.
Absolutely. Thank you for that. And definitely, you are correct, and you're not the first person to definitely voice that to us, that that needs to be added to the conversation. Anything else? All right, so I'm about to share my screen again for our next question. Okay. All right, so I don't know about y'all, but I like to spend money. So with that, we kind of have put this question in a way, hopefully, that we can definitely talk about the spend of it all. So what should we be doing? So one of the things is we're looking to, as part of this strategic plan, we're looking for a way to set up our celebration within 5 years. We're looking to make a difference in our community in the next 5 years. So imagine if the community had 50 million. Not to say that we're just going to give 50 million off rip, but we are looking to, this is just kind of big thinking. So imagine the community had 50 million over the next, to spend over the next few years. How would you see it used to better our community? So if you had 50 million and an idea, how would you see it used to better our community?
Well, just based on my past, and I'm kind of being selfish, but I think housing, adequate housing is critical right now. And thank heavens that we have funding that has been established, but I cannot wait to see what the plan is for housing development that will specifically meet its target and not be compromised as time goes on. There's a need for adequate housing.
Definitely, thank you for that.
I
Nothing
think
wrong with selfishness. Go ahead.
Okay, I would say we definitely need programs for the youth. I'm born and raised in Cincinnati, and when I was coming up, when I was in junior high school, they had programs where one of the jobs that I worked was at Crest Hills Junior High School, where I helped the secretary in the summertime. And so that was my job. I went up there for a couple of months through the summer and worked from like 8 to 3 or 8 to 4. And I was paid a salary for that. And that is my profession now. I'm an administrative assistant at Deloitte. And so I think having programs like that for the youth would be excellent to get back, have some money budgeted for that, as well as community activities where whether it's music programs, sports programs, the arts, that we really need to get our kids involved in things like that, because it does affect, it affects your brain in a different way, especially being on a sports, on any type of sporting team where, you have to learn to push your body, push your mind, and you learn to win and to lose and to work as a team. So I think that focusing dollars on the youth going forward would be an excellent resource to use for money for the 50 million, all of it or some of it.
I would say let's take it back to the beginning. First of all, let's make sure our women and our children survive pregnancy and childbirth. Okay. Have proper advocates to stop the medical apartheid that is focused on us. Have medical education and bring back our community centers to give our children safe spaces, and also to give ourselves safe space, because they have withdrawn those for the most part from the greater Cincinnati area, especially in minority driven and minority heavy communities. But we have to make sure we make it through birth first.
I'm with Ebony. I would like to see more community resource centers. I'm from Dayton, and I can remember when we had community resource centers where people knew the people, you felt comfortable going in. And now in Dayton, we have the job center, which it made it great and easier for the providers to be in one place locally, but it makes it difficult for the community to access those services, know about those services. It's very impersonable, become a number. So more community resource centers can actually house a lot of the things that we're even just speaking about here, right? Doctors, computers, education, programming, all those things. So I think community resource centers, Ms. Ebony, bring it back to the basics.
And also one other thing, I think we need to go back historically where we began and start our own nursing schools and medical schools, because too often it's still being taught that we don't feel adequate pain, that we make excuses for things, that we should not be taken seriously. So why not teach each other the proper way? We can take a page out of Chicago where they have their own team of EMTs specifically for us Black and brown people.
Great. Thank you for that. Mr. Kennedy, you have your hand raised?
I do. I do. Let me compliment you on what your vision is and what you guys are trying to accomplish. Your favorite question, if I read it correctly, in my interpretation, is flawed to some extent, because I think your question is, how would you spend 50 million? Is that correct?
Correct.
Okay. If you framed it as how would you invest 50 million, then you're looking for results and outcomes that multiply the investment itself. Does that make sense?
Yes.
And the ideas that are being proffered with regard to empowerment, enabling, those kinds of things become essentially the outcomes and results that you must measure, so that if in fact, and I pray you do, because I heard you very clearly, say you guys have an endowment fund, which for all intents and purposes tells me there is a pool of money somewhere that is funding your operations and funding your empowering and participating and coordinating and collaborating with other entities and things like that. I hope it's not a spend down endowment. I hope it's a sustaining endowment, so that, and that endowment can basically fuel $50 million of investments over the next 5 years, because I don't think this question came out of the blue. So my hope and prayer is that you guys are looking at these things in that context, and that you just kind of frame the words incorrectly, because there's a lot that can be done to multiply and 10x a lot of things that have to do, if it's about minorities, it's about housing, it's about access, it's about empowering and enabling and educating. All those things are imperatives that if you invest in the right way and collaborate with the right people, you're going to have the right outcomes that you can truly measure and say, hey, look, here's where we were, here's what we're looking to, what we look to accomplish, and here's where we are X number of years from here. I hope that's helpful.
Yes, thank you so much for that. And definitely, we are currently not a spend down foundation. So we are working to, and you definitely did say it correctly, invest in the community to measure and to find measurable ways to do that. But we also, with that, we also realize that we need to do new things. So the measurement might be the learning of that. The success might be just learning if something worked or not. Currently, we do a lot of planning grants and a lot of, we have some innovation funding. So to try something new, to try something that has not been tried either in this area or at all before. We do find that important just to offer that, to allow for capacity building and imagination of organizations to say like, hey, things that we've tried before did not work. We want to try something different. But definitely we're looking to invest in things that can provide that measurable impact. Thank you for framing it that way. Any other ideas though?
Can I say something?
Sure.
So my name is Jamie. I think that one of the things that needs to be invested in is the educational system in the city. It's one of the biggest issues that we have in the community right now, because the best schools to get into before, you had to sleep outside to get into them. Now you're in this lottery system, so you're gambling with the education, when the education of the children is what's needed for us to be successful in the future. And if they are our future, then why won't we give them all equal access to the right schools?
Absolutely. Thank you for that.
And I guess, Julian, my feedback, I like what I'm hearing. It sounds like what your organization does is you power a lot of other organizations. So I would say continue down that path. You know, find organizations that are aligned with your mission and all the things I'm hearing everyone say, and help amplify what they're trying to do. Because just one organization can do everything, but if you can help other organizations to be successful, then you have much more of a multiplying effect.
Definitely. Thank you so much for that. Any other ways that people would invest or spend? There is no, with this, we like for people to think big and think differently. So even if there is something that might seem off the wall for some, we would love to hear it.
All right, here's.
Oh, I think you
Hello.
went on mute.
Hello. Can you all hear me?
We can hear you.
Yeah.
I'm sorry. You can go ahead, Mr. Best.
Okay, all right. So I was going to say we should have, in the same mind frame of Regina's center, in that center, we should have financial education office for lower income people. So they're taught not to deal with payday loan places that are on every corner in the hood, and not take payday loans, and not go cash their check at these places that have exorbitant fees. Show them how to create a bank account at a good institution. How to deal with credit, how to pay down debt, how to do a budget, how to manage their bills, all these basic things that people need to know that they aren't taught in school, that we need to teach our people, to empower them and educate them to be financially literate, So that's what I'm talking about.
Thank you for that.
All right.
I wanted to provide some input, just based on some of the insights I've had from some of my courses. What I've noticed in a lot of policy and things that are brought forth by community members and even politicians at times, we spend a lot of time talking about getting more money, but there's always money being circulated that's not being put to use. For example, I did a project on like the Pell Grant and how a lot of dollars are going unclaimed. I think maximizing opportunity has to really start with like looking at the opportunities that are already out there and working to like improve those. So like if we know there's like the YWCA or something who are helping women and children, there might be other smaller organizations that could partner with them to like actually maximize the money and the literacy that's going on for those organizations. So I don't think giving more money is going to help. I just think that serves as another Band-Aid in different areas.
And I have a piggyback question to that, Jada. So what kind of things could we do to release the Band-Aid? Because I think you're right. A lot of times the things that are invested in are not addressing the root causes. And so if you had to give an example of like a root cause that us and other partners should really try to address, what would that be?
Thank you. That is a good question. So just typically I think like we always think about something fast and not always long term. So like thinking about, for example, if we know that students are struggling K through 12, not always looking at the downside. So I've had the opportunity to work in like the city, the state, and the local government. So like really leveraging opportunities. So like, for example, if you want the Ohio Department of Education to support more school funding and things like that, you have to really, the people who are at the state level have to be immersed in those environments, but also not just funneling money, you know, like in different agencies across Cincinnati, because I'm from Cincinnati, Cleveland, Columbus, Dayton, Youngstown. You can't just keep funneling money and expecting different results. We also have to have people who are in positions that are passionate about what they do. And I think that's where the politics and the funneling of money gets put out as like a Band-Aid over issues that are very important and that we keep addressing them, but not really addressing the root causes. So I think that's definitely a point of reflection, but just in my experience so far, it just seems like a lot of it's like, okay, let's throw dollars out here, whether that's corporations or nonprofits. Both organizations are responsible.
Got it. Thank you.
I appreciate that, but here's something we also need to be aware of. While there's a lot of dollars being thrown around, there's not a lot of dollars that are being distributed. A lot of the funds are here. A lot of the agencies have the money and they've admitted it, but they say we don't know how to give it out. So is it really reaching the people? Is it really, or is it sitting in a bank account? A lot of it's sitting in a bank account undistributed. The CARES Act funding is just sitting there because they say they don't know how to distribute it. We need to deal with the money flow problem. We have a money flow problem. Yeah, the money's there, but the citizens get it.
Yeah, definitely. That's what I was trying to get at. Like the money is not being allocated. We have people saying they're going to donate this amount of money. We never hear about it. They spend more time marketing about donations than they actually do providing it to different groups and things like that. So that's what I was trying to get at. So thank you.
You know, thinking big, a couple of things that come to mind is maybe some kind of accountability system. So when all these promises are being made, all these pledges are being put out there, something is tracking it down to make sure it's actually happening, right? So you can do that from your perspective, but maybe in a bigger level, monitoring and something like that. The other thing I think, if just thinking big with a lot of money, is maybe starting to look how to put politicians in place that are actually going to help us. They're there for us, right? So you know, to help make the changes we want from a government level. So that could be something else that the money could be, invested towards.
So kind of going back to making sure that the money is going to the organization and kind of reaching the people. What is the best way that we can show that? I mean, we can definitely do like some type of report. We used to do like check presentations, stuff like that. Do you feel that that's worthwhile? Is there another way, a better way, a different way that we can show that a better interaction?
I mean, making it public is great. I think even if you were having a listening session like this is great, right? We have 25 or so people on here, but if we were on this call and you were like, wow, we put $250,000 in this organization, $1 million in, like, show us that the money is going to organizations and what those results of those organizations, we would tell people in our community. But what happens is we just see the press releases, but we don't actually see like the result of who received it and what they did with it. So I think that would be helpful. And then on social media, I mean, all the corporations are great at putting out press releases on how much funds are available, but then we never hear about if any of those funds ever. So I think in your case, if you could do that, that would be a big win for Interact for Health. I mean, either report, listening sessions, or just a follow-up post end of the year information about what actually happened, who got funded.
And just for clarification too, so that's the learning for us, but then even what I'm hearing too is that it's an accountability also as a community that's needed across the board. And so that's something that we can share out or even talk to our fellow foundations or even folks giving out money, that this is something that people want to hear, right?
Yeah, exactly. Okay. It's across the board. I mean, we don't see
if you can build an accountability system, beyond, like you said, within Interact for Health, but even beyond that, since I think that's your question. It's like, how can you help improve things generally? Yes, that would be a really good thing to have.
Right.
Now, because they're nonprofits, technically, some are for, but the ones who are nonprofits, I guess this question would almost be directed at Michael, having, been at Fifth Third in banking. Is there a way to have a connection where the financial institutions will give a report for the sake of the public, or, generate some sort of report of this is how much money was received from this block grant or this community development grant? And here's where you are month to month, instead of a yearly annual report after the fact, every single month or every 6 weeks or every quarter, here's the money that's there. Now, if nothing was spent, it's going to stay the same, but almost like a profit and loss statement for the money that's been distributed, because I think that's the only way, because if you put it out there on the front street, then they have to respond. But if it's hidden,
nothing like that exists, Tiffany. So I think that's what we're talking about. There's just
I would call it an impact report.
And one thing too, like the financial reports, like the CAFR, the comprehensive annual financial report, a lot of information, if you look at different cities, they're missing information because they know people are not aware and they're not looking. So like if something was going to public transportation, nobody is going to really look at that unless it's really affecting them or they're in a political standpoint. So I would just say, like, making sure people have some type of awareness and that what they're doing in this system is actually an investment to where, one, is accessible for people that they're serving, but also that it's comprehensive.
so almost like a task force that does a system of checks and balances from entity to entity. They're neutral. We just give reports. We don't have feelings. We just give reports. That's all we do. We're here to look at the money. We'll generate the report and we'll move on to the next organization. We almost need a task force.
It's essentially an audit. It's just that it's like an ongoing audit that's needed to show what's happening and what's going on.
Well, I was in a meeting with the Attorney General, and here's something that they said. Audits don't tell you if someone is stealing the money. Audits really don't do anything for you. That shocked me, because they do investigations of entities where money's been misplaced or not given where it was supposed to. She said, we found over the years that money does not show you if the funds, money's just a report. It doesn't tell you what's really there.
Yeah, so I'll make sure we get focused on we want to make sure that when an organization comes out and says they're going to put $5 million to help the Black community, that they actually put the $5 million in the Black community. They don't just get the props for saying that they're going to do it. I mean, that's the thing I see that's constantly happening worldwide. I mean, it's not just a Cincinnati thing, everywhere.
So in my opinion, a nonprofit is about making a positive impact in the community based on whatever their cause or goal is. So I think all nonprofits should have an impact report. How many lives were affected? How was the goal met? Where did the money go? And how many people did it help? So every quarter maybe, and then a big one at the end of the year.
I like that impact report.
Yeah, impact. What's the impact of your nonprofit?
Yeah, we Black Achievers does that.
And many do. I think
many do, but
that's also that's the thing that I think is upsetting most people here is not necessarily the nonprofits, is the corporations and people who are using, saying they're helping the Black community, getting all types of props and everything, and they're not actually doing anything. Like, it's just
right.
But
we need to hold them accountable.
But to Ken's point, an impact report would be good, just to also keep nonprofits accountable. So when they are getting the money, if they're not using it, at least we know they're not using it, and then maybe people can ask questions and encourage them to do what they say they'll do. So
they're two separate things. Yeah,
exactly.
Yeah, two separate things. All right, Julian, we're gonna let you reel it back in, or did you?
Yeah.
No, that was good. Definitely. Thank you so much for all of that. And I have one more question, and we've kind of been discussing it throughout the whole entire time. Let's go back to here real fast, and then I will wrap us up. So again, what should we focus on? And we kind of been discussing that, looking at some of the different areas that we feel that we have a unique area that we can kind of focus on. But from your perspective, what are the most important issues that Interact for Health could address? And we definitely discussed affordable quality housing, but we talked about health workforce, we talked about mental health for both youth as well as adults. We talked about social service access, making some of those community hubs, resource centers and stuff like that. But is there any beyond that, is there anything from like this list that really rise to the top for you that we haven't really discussed yet?
I think, Julian, for me, one of the things that we really haven't discussed is the racism and discrimination that's taking place. That's why we're here anyway, that we have to intentionally focus on Black folks, right? So
I was glad to see that on there.
Absolutely.
Like, that's like root cause of all of these things, right?
Yes, that's just why we're here. So if we can get some of that structural institutional racism and discrimination under control, that's systemic.
Yeah.
So Julian, so, I mean, I think we talked about housing and some of the food, but like gun violence, racism, like who do you fund that's in this racism discrimination piece, or what?
So some of these would be new for us, that we have been at the table for a lot of these different things. So around racism and discrimination, of course, we help fund All In Cincinnati, who's doing a lot of that work through the Greater Cincinnati Foundation, working on some of these systemic things that are happening. But even such around gun violence, we're talking with the Heights movement, where they're working in Lincoln Heights with the gun range that is in their backyard, and kind of figuring out what's going on there and how that is just that kind of systemic stress that is in that community. But there are other opportunities that we're looking to open up. So if, let's say that we want to focus on specifically gun violence within the greater, like in Cincinnati, within the urban core, we will be looking to work with an organization that is looking to do maybe a street team or any type of new innovative idea. There could be possibilities for that.
Would you be willing to work with people that are actually writing legislation and writing bills within the greater Cincinnati area to cut it off at its core?
So, yeah. Go ahead, Ashley.
Yeah, I was gonna say, I mean, I think like what we're trying to do is like, if enough of people say that you all should be, to your point, working with elected officials and looking at how legislation is being written, then that's something that we're going to try to figure out. How can we actually do this? Who do we need to work on? So if you guys are bringing these issues to the top, like when we talked about racism and discrimination, a lot of you were surprised to see that and acknowledge that it is a root cause. And so for us, we're like, hey, we had a conversation and this rolls to the top. We really need to make sure, how do we identify folks in the community that are doing this type of work? How do we support them in their efforts? So Ebony, I think you're working with legislators. Yeah, I think all of that is on the table. And when you think about, how do we really have change? You might hear people say this, and I wholeheartedly believe this, like, we're not going to program our way out of racism and discrimination. Like, it's going to take us some intentional focus on changing policies and systems. So your suggestion is really right on point.
Well, it's because people always like to say that the system is broken. It's not broken. It's working exactly how it's intended.
Right, exactly.
Absolutely.
For about a year and a half now, I have been working with some lieutenant governors, some senators, and some local Congress people to write legislation and bills and work with lobbyists to get comprehensive police training, comprehensive police dismantling and rebuilding, and discuss other systems, because we can keep fighting the system as it is, but we're going to lose because it's working how it's intended. We have to go to the root and go, you know what? It's Harriet, Martin, and Malcolm walked so we can run. It's time for us to pick up the baton and run.